Hi, my name is Erin Gilbride. I'm a first year graduate student at the University of Akron in the Child Life graduate program. And this is my first recorded online interview, so bear with me. So I'll start by reading the first question, which is to tell us about an outstanding supervisor that I've had. And the first person that comes to mind is my first supervisor actually out of college when I was hired as a title literacy support teacher in Lakewood, Ohio at an elementary school called Roosevelt Elementary. It was a K-5 building. My supervisor was my principal. He was my direct supervisor. He hired me. His name was Mr. Kiefer. And Mr. Kiefer was a very enthusiastic guy and very inclusive and made his school feel very much like family, very motivated about education and family in general. He was always praising his staff, always very, very complimentary, but also gave great constructive criticism, not only praise all the time. He was also, above all, extremely knowledgeable about his craft and his subjects. He always knew the latest coming out of Columbus for education in Ohio, and then also was very up to date with the local superintendent as well. So he always had meetings with the staff to keep us up to date. It just felt like we were always on the cutting edge of education in that school. The next question is, what did this person do to encourage your best work? And Mr. Kiefer definitely encouraged his entire staff's best work, not just me, but he had a knack for assigning the right people to the right job, having the right driver in the driver's seat, so to speak, and in that he felt comfortable and confident, more confident in the job that his staff was going to do, and that allowed him to take a couple steps back and kind of let everyone work their magic, so to speak. So he was not a micromanager, and we really were able to flourish and use our talents to the best we knew how. And I think people tend to work best in that way, depending on the person, but I tend to work best in that way. And in addition, I was a brand new teacher, and there were a couple of us. He really encouraged collaboration amongst his staff, and I think that was especially valuable for me as a new teacher because I learned from some of the best there, and I was encouraged to do so. And on the flip side of that, I think those veteran teachers ended up learning things from us newbies as well, because we had some fresh new ideas as well. So he really did encourage all of us to do our best and do our best together. And the next question is, how did you contribute to your supervisor's experience? Which I think is a great question, because every supervisor I've had, whether they're very strong like Mr. Kiefer or maybe somebody weaker in my estimation of them, I feel like the stronger the supervisor, the easier they make their own job, because they are able to allow their staff to do all the troubleshooting and putting out fires for them. And in that, as I mentioned before, Mr. Kiefer was a very kind man, and that trickled down to the rest of us. I think his entire staff treated each other with kindness and respect, and there were very few, staff disputes or drama within the teaching staff. And I think that was a direct product of how he treated everybody else. He also held as a very high priority communication. I mentioned that he had us in meetings all the time, keeping us informed, but he also kept the parents and the families informed. And I think that did wonders for keeping their confidence and their morale in our school. He didn't have to deal with a lot of angry parents showing up in the office or calling. It just overall made his job a lot easier. So the next question is, please consider the concerns and interests that are typical of patients in the areas of developmental levels of infant and toddler, preschooler, school age, and adolescent. And when I think about developmental levels, especially as a future child life specialist in a hospital, I consider the hospital a huge learning experience for many children, filled with a lot of unfamiliar experiences and things around them. So in that, I think they're processing all of those things in a cognitive way. So I go to Piaget and his theories of development, which are cognitive, and he starts out with that infant stage, which is the sensory motor stage, and talks about how infants are, from birth to 2, are basically using their senses because that's all they have. They don't have any language or higher order thinking, so they're using their senses to explore the world. And in that, they're born with these awesome reflexes that a child might kick his leg and he might not have the coordination to stop himself from kicking his leg, but gets a reaction from a toy or something that he kicks that makes a sound, and then he realizes, oh, there's a cause and effect here. If I kick my leg, I'm making a sound. And they start that cause and effect thinking and realizing that they might actually have some sort of control over themselves in the world, and then the coordination develops from there. And from that sensory motor stage, they're moving into the pre-operational stage, where they're learning that they're still very much learning with their senses. And in that, they are exploring with their senses, though, and able to maybe start, because pre-operational is age 2 to 7. So they're starting to put words with things, starting a little bit with symbolic thought, in that even though this they don't know the name for this, but now they're starting to put that symbol, that name, with an item. They're still egocentric, and everything is very much around their experiences, but it's just starting to develop from there. And from there, Piaget talks about the concrete operational stage from ages 7 to 11, where the child's logic is starting to increase, and we're starting to really put concepts together and multitask. Could be doing something but thinking about something else. From there, going to the formal operational, and from ages 11 to 15, where we're really starting to increase our abstract thought and our logic, able to think about the philosophical things in life. So Piaget is a huge influence in the way I think about children in the hospital, because they are learning so many things, and they're learning them in such different ways, depending on their developmental phase. So the next question is, how would you go about introducing yourself to a patient in each of those groups? And I've actually done this in my volunteer time in the hospital, in my direct experience class when I was at Akron Children's last semester. I've had to introduce myself to all different ranges of ages. And I've also taught in the classroom different ranges of ages. But for that infant phase, again, they're very sensory oriented. So, and their favorite toy, one of my favorite quotes when I was a new mom was that your infant's favorite toy is your face, or their mother's face. So I think that says a lot in how you're going to introduce yourself to an infant. You're going to be expressive and smiling, and maybe expressive with your eyes as well. We're going to use a soft voice because they have that startle reflex and they're very easily startled. So no big movements and no loud voices, very soft voices and sing-songy, because all of those things appeal to their senses. And then for a toddler, the way I would introduce myself, I think I would be getting down on their level, so on my knees on the floor, sitting on the floor. I would have an object of interest to them because, again, they are pretty egocentric, and so anything that might interest them, I'm not going to talk about myself to a toddler. I'll direct the conversation around their interests and things they like. So I'm thinking about my little buddy Connor, who's 3, and he is very into trains. So I would be on my knees with the train. I don't think I would direct any conversation to him right away. I would be talking to his mom about something that Connor might be interested in, because I think it could be a threatening thing if you are directing, a formal conversation right at a toddler. As far as the preschoolers go, I would be, again, I think that they're still a little bit egocentric in their thinking, but they're also capable of a little more conversation. So maybe I would talk a little more directly to a preschooler, but about something that they are interested in, and ask them questions about themselves. And I know that preschoolers are real responsive to enthusiasm, and they're easily excitable. And to me, preschoolers are pretty easy to introduce and talk to, because they are just kind of have a interest in life and all around them, and see things in a very magical way. And I think it's pretty easy to start a conversation with them. As far as like school agers go, I think that you can take that even further. You can start talking to a preschooler in a more direct way, or have a real conversation with them. But I think school age kids, you can really sit down and direct conversation with them. It doesn't have to be all about them. They're able to think about other things, empathize with other people, talk about a little more higher order things. So I wouldn't feel as pressured to have a distraction item to take the pressure off. I think school agers are a little more apt to engage in a real conversation. And then adolescents, even more so. I think adolescents appreciate being spoken to in a mature way, a non-condescending way, and really just talk and have a conversation. And I think it has to be age appropriate, and you have to judge by the individual child, but I feel way more comfortable directing a real conversation with an adolescent. So the next question is, what would you offer to comfort the patient during a painful event? Okay, I wanted to make sure that was still video recording. So for an infant, it goes back to the sensory motor. It also goes back to Erickson's developmental phases, where he talks more about the psychosocial development, and infants are in that trust versus mistrust phase. And so I think the best item you could give an infant who is about to have a painful procedure to promote and bolster that trust in a caregiver is the caregiver, him or herself, and make sure that the child sees the caregiver, maybe do a little pre-counseling with the caregiver about how the baby is going to sense your anxiety. So maybe try to tone it down a little bit and be, that comfort for the child. I think that a caregiver is the best thing you could give an infant going through a painful event. They may respond to a sensory distraction as well, like a spinning light, or a toy that makes music or something like that. But I think the parent is the primary intervention I would use. Toddlers, I would use more of a sensory distraction, music, or even like a popsicle from the fridge might distract a toddler enough. But I would also include that caregiver in that phase as well. And then for preschooler, I think preschoolers are starting to think in a, like I said, a symbolic way. They're starting to connect words with concrete items, and that's a symbolic thing. So they're also starting to use those comfort items and connecting their teddy bear with a feeling of comfort. So I think those comfort items are big for preschoolers, a blanket or a teddy bear. And then I think distraction always works as well. And preschoolers are really starting to pick up that technology so quickly these days. So an iPad or anything that might interest them. For school ager, I think that distraction is a great intervention. I think that they are starting to be able to see how their actions will affect the future, or the way that the outcome's going to be. So I think I might even start with a reward for school ager, depending on the child. But and I wouldn't do, like, if you're really good during this procedure, you're going to get this reward. I would maybe introduce a coping technique, like breathing or humming or meditation or something, to even just to introduce it. And even if the child isn't successful in limiting their anxiety during that procedure, I think even if we just say, all you need to do is try it during this procedure. And if you do a really good job just trying to breathe through it as much as you can, we'll go down and pick out a reward, because now they're able to connect their actions now with a future reward. So as far as adolescents go, again, they're more abstract thinking, and they'll be able to use that way of thinking to meditate or do therapeutic breathing or relaxation techniques, and really be able to rise above a painful procedure. I think they would also react well to a reward as well, because you're never too old for a reward, probably. So the next question is, what would you provide for developmentally supportive play? And for that infant, and I think we just talked about that, anything that stimulates their senses or their developing acknowledgement of cause and effect. So a flap book, those toys that you turn and they pop up, Jack in the Box, peekaboo, anything like that are developmentally appropriate. For a toddler, toddlers are starting to have that coordinated movement, so I encourage movement in physical toys like the Cozy Coupe cars or tricycles or scooters, or anything where they're really able to practice that gross muscle movement. For preschool age, they're easy, again, for me to connect with on that imaginative level. I have a lot of toys that encourage imagination, whether it's dress-ups or doll houses or baby dolls, any of that medical play in the hospital with the stethoscopes and the blood pressure cuffs, all appeal to kids in preschool because their imaginations are so developed at that point. For school agers, I think going back to Erickson's stages, there's that industry versus inferiority at that stage of the school ager, and I think that anything where they can use those skills that they honed as preschoolers and have now all these great, awesome skills, now they want to use them to build things and do things. So crafts and art and Legos and puzzles, anything that they can use that skill and do something that they're going to be proud of when they're finished. And then for adolescents, Erickson talks about their stages being the identity versus role confusion. And so anything that promotes their sense of self and exploring their own feelings and how their feelings fit into their environment and the world around them. So journaling or anything self-expressive, journaling, dancing, recording, music, interviewing people, anything that allows them to connect with others and really see how their actions can fit into the world around them. The next question is, what factors might contribute to a patient's adult caregiver being especially anxious during a hospitalization? And I would say there are many reasons that a caregiver might feel anxious in the hospital. I think as a parent, it's very easy to imagine feeling possibly the greatest amount of anxiety you can when your child gets sick. There's a innate and very instinctual bond between a parent and a child, and the parent's job and sole purpose in the world a lot of times is to keep the child healthy and safe. And I think seeing a child in the hospital is a negative and sad thing for anyone to see, but I think for a parent to see their own child in the hospital is it's almost a physical reaction of, fear and anxiety, worry, concern, desperation sometimes. And I think you can see that in some parents in the way they conduct themselves in the hospital can come out a lot of different ways, but I think when you realize the real reason behind it, it's more understandable. I think it can be easier to deal with that parent. On top of that, just basic instinct reaction, I think a lot of these parents are sitting in chairs next to their child's hospital bed, and unfortunately the world outside doesn't stop or come to a halt, so they still have a job that they're not attending. They may have other children that they can't help or nurture. They have house bills, all those things, and I can imagine it piling up in somebody's head as they're stuck in a hospital room. And then in addition, I think a lot of people have just a general anxiety when it comes to hospitals or doctors or needles or blood. And so being in a hospital for a lot of people can be a stressful thing anyway. And when you don't have any control about whether you can walk in or out of that hospital, I think that's a anxiety-inducing problem as well. So the next and final question is, what are your favorite ways to play with children? And I have all my questions right here. That's fine. So this is an easy question for me because I play with kids a lot, and I have for my entire career, my entire life really. And so I think that I'm pretty experienced with it. So I think with the infant and toddler stage, that's one of my favorite stages to play because it's so easy to get a happy or positive reaction out of an infant or toddler by playing with them. That cause and effect is so a part of their play, and it can be as simple as a peekaboo or anything that responds to their actions and they can see a reaction. It just tends to tickle them, and you get big belly laughs, and it's just fun to play with that age group for me. With preschoolers, I have a lot of experience with preschoolers because I substituted in a preschool classroom, and I've had 4 preschoolers of my own at home. Their imaginative play, like I said before, is just so at its height, and there's nothing better than listening to 2 preschoolers in the zone of play where they have shut out the rest of the world and they are just a mommy and a baby or a teacher and a student, and they don't know that anyone else is even listening. That's been my favorite part of being a mom, is listening to my kids play. But I would love anytime you can give them dress-ups or just toys, dishes even from the kitchen. and just let their imagination run wild. With school agers, I love to do crafts and arts with them. Like I said about Erickson earlier, it's just so easy to tap into that sense of industry at that age and see them feel that pride as they are practicing their skills and learning new ones as they are practicing. So, and then for adolescents, I would say I don't have the most experience as I do with the other ages with the adolescents, but I do love engaging adolescents in conversation because I love the way their minds work and just asking them questions. I have a lot of nephews and nieces, and the older ones are just starting into adolescence, and knowing them as babies and seeing the things that they want to talk about now, and they're engaging me in conversation, it's just amazingly rewarding, and it's always amazing to me how kids develop. And when I'm thinking about all those ways that I like to play with kids, I think that it kind of underscores that I love to see how kids' minds work, and that is why I have chosen this field and why I've always chosen fields with children, and I just hope that I can continue doing that in my career. So thank you so much for this opportunity. I appreciate it, and appreciate you hanging in there with me for my interview. Thanks.